Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, May 6th, giving you the update from Albany Med. All right, Fred, this is our only video this week.
That's right.
We missed Tuesday, but we're here on Thursday. Let's pop open the graph. Here's the capital region, people currently in the hospital with COVID. The number currently, Fred, sits at 85. If you compare that to the highest watermark where we were at 550 plus, it's about 15% of when we were at the highest. So
that's right, Dennis. And it's been going down the past couple of days, maybe
right.
a week now, so that's a good sign.
Next graph, specifically here at the medical center, admissions and discharges. And not only can you see visually, it's really about 1 or 2 admissions a day, but below the line, Fred, which represents discharges or people who have died, in there is a good number, which is that the number of people who are in the hospital dying has dropped off.
It has.
They're represented by that black color. And
that's
so
right.
Clearly we're seeing less of that, and that's good news.
That is good news, Dennis.
So let's give the morning census here at the medical center. We currently have 23. The breakdown is 12 on the floor, 11 in the ICU, 5 on ventilators. 2 of the 23 are pediatric. Fred, any idea about the no longer infectious group in that 23?
I believe it's 3 today, Dennis.
Okay, very good. And we're also still finding cases occasionally where they don't present in a typical way. They're kind of a case that we may find when they come in for something other than COVID.
Right, we've been calling those incidental
Right.
COVID cases. They test positive when they get admitted, but they're here for something else.
The other number, which is an encouraging number, is the percent positive, and in the capital region, that number now, the 7-day rolling average is 1.5%, which again is trending down. It was
right.
middle 2s, 2, and now it's under 2, so that's great news. Let's talk about some more good news. Let's talk about vaccine numbers. Fred, in New York State, we've now gone over 9.3 million people have received at least the first dose of a vaccine.
That's great.
In the capital region, these numbers are really impressive. So first of all, capital region, 570,000 people have received at least 1 dose of a vaccine. Now we know in many cases, if they got the Johnson & Johnson, then they're done.
1 and done.
But think about 570,000. Think about how many times you'd have to fill up Yankee Stadium or Giant Stadium to reach that number.
That's right.
It's a huge number.
It's more than half the population.
It's more than half. In fact, let's talk about that. So as far as the total population goes, that represents 52.9% have received at least 1 dose. If you look at those 18 and above, Fred, that's 64.3%. Both of those numbers, if you look at the 10 regions in the state, those are the highest in the state.
Dennis, we're like 5 or 6 percentage points better than the next closest region in the state.
Than the state average. Than the state average, yeah, which is remarkable. So credit to everybody who is doing that and making that happen. Everybody from the pharmacists to the hospitals to the county health departments to the larger vaccination sites. Fred, there's some word that has been reported that perhaps the eligibility criteria is going to change, and they're going to now allow another group of people to get the vaccine.
That's right, Dennis. At the end of March, Pfizer reported on the 12 to 15 age group, the adolescent age group. They did a study on over 2,200 adolescents, and none of the children who were vaccinated got COVID in that study.
Wow.
So that's now gone to the FDA, and we're expecting that maybe this week or next that the FDA is going to expand the EUA to include that population.
That's incredible. So what that means is that it's certainly likely within the next couple weeks we would be vaccinating people in that 12 to 15 group, and it could be as early as next week.
It could be as early as next week. That's right, Dennis. And that would be the Pfizer.
That would be the Pfizer. So capitalregionvax.org will be your best site to go and get that information. And once that's opened up, that would also be a great place to find out where you can get vaccinated.
And they're actually studying the 2-year-old to 11 age group as well. And perhaps sometime September, thereabouts, we'll have some news on that group as well.
Well, the 12 to 15 is very exciting in the McKenna household. There's 2 more that are now going to be eligible, and we'll certainly get them that vaccine because it's safe and it's effective. And so that's an important message for everybody. Fred, let's change gears a little bit here. Let's talk about length of stay. On Thursdays, we like to talk about how things are going. You and I, of course, attend the safety brief every day. We're starting to hear some encouraging numbers come out as far as efficiency and length of stay reduction.
So, Dennis, if we pop up the graph, you can see here, again, the dotted line includes all discharges. The solid line is the non-COVID. So, first of all, the 2 lines are coming together as we have fewer COVID patients in-house, and they tend to have a longer length of stay. But there's also a downward trend in both, which I think is important. And that's happening, Dennis, as our census is going up and our admission numbers are going up. So There are a lot of people doing a lot of things, like literally 100 things differently to try to move people promptly through their hospitalization and get them to the next level of care that they need. So they're doing a good job. We have room to go, though.
You're correct, Fred. In fact, you bring up an important point. So the hospital census today is getting closer to 700 than it's been in a while.
Yeah, 690s.
690s, more complex surgical cases, more transfers coming in. These types of patients historically carry with them longer length of stay. So if the length of stay in the house is going down despite that, or with that happening, then obviously there's a lot of good work happening.
Absolutely.
Speaking of good work happening, let's talk about today. We had the first day of the Bernard and Millie Duker Children's Hospital Annual Radiothon. Very exciting. I was down there this morning and it was lots of fun. A lot of volunteers from the medical center answering phones, talking on the radio stations, having an opportunity to meet up with some old friends. Fred, 99.5 The River and WGY are the two radio stations that are helping with that. Today it'll run till 6 o'clock. Tomorrow it starts at 5:30 in the morning and it goes to 6 o'clock. So obviously we ask if you're interested in helping participate in that, would like to make a contribution, there's ways to do that.
That's right. The number to call if you'd like to make a contribution, I got to read it so I don't get it wrong, 877-810-KIDS, K-I-D-S. That's 877-810-KIDS.
And we talk
Give us
about
a call.
Kids Call. So we talk about this a lot. I mean, the importance of the Children's Hospital in this region cannot be overstated.
It's very important.
Not only does it provide world-class care, and it provides specialties in every different discipline, but it allows families to stay local rather than traveling to New York City or Boston or Philadelphia to get that world-class care, which we know is so important, especially for children.
It's really a unique service provided to this community, Dennis.
Yeah. So, and thank you to our partners, WGY and 99.5 The River, for helping with that. Yes. Today, Fred, also kicks off a very special week. We celebrate it every year, and this year, like every year, it starts on May 6th, and that week is
Nurses Week.
Nurses Week. So,
yes.
So Fred, why don't you tell us a little bit about the history of Nurses Week?
Well, Nurses Week corresponds to Florence Nightingale and her birthday.
Sure.
Actually, her birthday is May 12th. She was born in 1820.
Nice.
And every year, Nurses Week starts obviously just before that, and the last day of Nurses Week is on her birthday. So it's a celebration of all the good that nurses do for our community, for the medical center, but also for their patients and each other. It's
really a fun week here because there's a lot of different ways in which it's celebrated. Sort of the capstone event is the recognition of the often half dozen nurses that are recognized as pillars.
That's right.
There's a great ceremony there, but there's a lot of activities every day. We know that nurses obviously are involved with people who are injured, people who are ill, people who are sick or dying. I mean, they're true professionals. And I think you have some facts about it. We call it Facts by Fred. You have some other nurses about Florence Nightingale or Nurses Week?
Well, Florence Nightingale really founded professional nursing, if you will. So in the Crimea War, back in the 1850s, I think it was, she was the manager and trainer for nurses caring for wounded soldiers, and did that in a very compassionate and scientific way. Really very, very important work that was done then. She also went on to do lots of other things, including starting the first secular nursing school in London at St. Thomas Hospital.
So,
and there's a very important thing that nurses do when they graduate, much like physicians, Dennis.
So we do the Hippocratic Oath.
That's right. And what do nurses do?
They do the Nightingale Pledge.
That's right.
That's right.
That's right. Very important. So she's really a very important figure in nursing.
Well, it's a great opportunity to use her birthday as a touchstone moment for us to celebrate.
Absolutely.
So we kick off Nurses Week today, and we'll celebrate it through the rest of next week. All right, Fred, we're rolling into the weekend.
That's right.
And hopefully the weather's going to get better.
I don't know.
It's been a bit rainy, but we need it, I guess, for the flowers. And we'll be back again next week.
On Tuesday.
All right, very good. We ask that you all, once again, please take care of yourself, take care of each other, and we'll see you next week.